Good evening. I would like to thank you all for coming out tonight. The purpose of this speech is to inform you all how diabetes develops, the importance of early detection and diagnosis, and various treatment options that are available for diabetes. Does anyone here know of someone who has diabetes? Raise your hand. Okay. So we all know someone that has diabetes. So we can see just in this small group that diabetes is an issue in the United States and all around the world. And I'll never forget the day that my younger brother Colton was diagnosed with diabetes. He was 8 years old, and at the time I knew what diabetes was, but I wanted to become more familiar and learn how it was going to affect him and our family. The American Diabetes Association released a 2011 National Diabetes Fact Sheet at diabetesorg.com. On January 26, 2011, it revealed that 25.8 million children and adults have diabetes in the United States. That is 8.3% of the population. And diabetes is a tad bit more prevalent in men than it is in women. So let's briefly explore what insulin and glucose is and how it pertains to diabetes. Normally, the hormone insulin is secreted by the pancreas in low amounts. And when a person eats a meal, that glucose, is also known as sugar, from food stimulates the pancreas to release insulin. An article called What's It All About, located at diabeteswellness.org, says that diabetes is a defect in the body's ability to convert sugar or the glucose to energy. And we have to have that glucose to function and stay alive. Does anyone know how many types of diabetes there are? Okay. Anybody want to take a guess? How many? Good. I went a little deeper than 2, and there is 4. 4. But good answers. It just depends on where you research at. There are 4 types of diabetes: type 1 diabetes, type 2, pre-diabetes, and gestational diabetes. So type 1 diabetes was previously called juvenile diabetes, and it occurs when the body's own immune system destroys the insulin-producing cells in the pancreas, and that is the type of diabetes that my brother has. A person with type 1 diabetes, they may have a pancreas that doesn't produce any insulin at all, or it may be excreted in extremely low amounts. Type 2 diabetes is the most common form of diabetes, and it affects about 90 to 95% of the population of that 25.8 million people that I was talking about. Type 2 diabetes is also called non-insulin dependent diabetes, and it's when the pancreas produces insulin, but it isn't enough insulin, or the body cannot use the insulin adequately. Pre-diabetes, our third type, is when blood glucose levels are higher than normal, but they're not quite high enough for a person to be diagnosed with diabetes. Gestational diabetes is first recognized during pregnancy, and it affects about 4% of all pregnancies. The cause of diabetes isn't entirely clear, but there are some factors that increase a person to becoming diabetic. And an online article called Type 2 Diabetes Causes and Risk Factors at webmd.com said that some of the factors that make a person more vulnerable to becoming diabetic include genetic risk factors, stress, age, ethnicity, and obesity. There are many signs and symptoms that a person can exhibit if they have diabetes and if they're pre-diabetic. Some of those symptoms include fatigue, excessive thirst and appetite, frequent urination, and slow healing sores or cuts. And there are 2 types of tests that you can have done to determine if you're diabetic. But an article called Diabetes, Many Have It and May Not Be Aware of It at informedby.net says everyone aged 45 and over should be tested for diabetes, and even if the results come back normal, they should still be retested every 3 years. And the names of those 2 tests that you can have done to determine if you're diabetic is a fasting plasma glucose test and a casual or random glucose test. And if diabetes is left undiagnosed or not treated properly, it can lead to many complications. But lastly, I would like to discuss prevention and treatment options for diabetes. Diabetes can be a debilitating disease, but with adequate treatment, the long-term effects to the body will be less damaging. Type 1 diabetes is treated with insulin, exercise, and a diabetic diet. And if Colton, if you don't mind coming up here, I can show you one way that a diabetic person could get insulin. And Colton has an insulin pump. So some people have that. Thank you, Colton. And some people can have it through an injection. It just depends on how a person would rather have it. Type 2 diabetes is treated first with weight reduction, a diabetic diet, and exercise. And if those measures fail, oral medications may have to be taken. A web article at diabetesguide.org called Prevention of Diabetes. It listed a few ways that you can try to prevent and treat diabetes. If you smoke, you can quit smoking tobacco, try to quit drinking alcohol, join a support group, lose weight if recommended. So in conclusion, my 3 main points are how diabetes develops, the importance of early detection and diagnosis, and various treatment options that are available. And as we all know, we may have heard on the news how Paula Dean, she's just coming out that she was diagnosed with diabetes, and she has type 2. And she said something the other day on the news that diabetes is not a death sentence, and I strongly agree with that, because if diabetes is diagnosed properly and treated, you know, a person with diabetes can live a normal life and probably outlive the normal average person. So thank you so much, and I hope you enjoyed it.